All right, so we got 2 implants to do here in about an hour. So I'm just kind of reviewing before we go actually to surgery. So we're gonna do one on number 7, one on number 12. And these are my favorite implants, 3/6s, 3/6. So number 7 is gonna be an immediate implant where we have to remove the tooth and put the implant in at the same time. So for this one, we're actually choosing quite a long implant so that we get a bite of the apical bone, and we're gonna get a big bite of this distal bone, but still facially and palatally, our bone is pretty thin. That's why we're going with kind of a smaller implant for this one. So we're gonna do a 3/6. Same for number 12, we're gonna do a 3/6. Hard part about this one actually is it's adjacent to an existing implant that she has already. So with flap design here, we have to be really, really careful. So oftentimes I usually don't like doing a tissue punch, but for this one, this will probably be a case in which I do a tissue punch. Tissue punch is where instead of doing a flap, we have a little instrument that will punch the keratinized tissue out of the way so that you can do the implant without actually putting a flap on the patient. Yeah, just punch a little hole in the gum and you just put the implant straight through it versus doing a flap and exposing all the bone. For this case, I don't want to disturb all the biology going on with her successful implant just distal to us. Oftentimes, while I don't like a tissue punch because I'm getting rid of good tissue and I can't necessarily put it back, this will be a case in which I do so because I just don't want to disturb the implant behind it. One trick you can do with the tissue punch though, you punch the tissue out. A lot of people just take that little piece of tissue and they just toss it. Keep it, because I can actually suture it back on if I want to.